I'm here today with one of our senior partners at HRC Fertility. This is Dr. Michael Feinman. What is kosher IVF, Dr. Feinman?
To explain that, let me, if you don't mind, take a minute or two to explain kind of what kosher means. So everybody sort of has an idea that it means something in the Jewish religion that makes it permissible. And finally, which is relevant to our conversation, is it has to be supervised. When IVF came out around 1980, the Catholic Church said, no, you can't do it. A fertilized egg is a human being. And to this day, technically, IVF is not permitted by the church. However, the rabbi's first question wasn't that. What their concern was, how do we know they're getting the right embryo? So what they did was they actually created a system of supervision where they send trained women into the lab to watch every step of the IVF process from the time the eggs and sperm get to the lab to the time the embryos are transferred, even when they're frozen, defrosted, all the steps when there could be potentially an error.
And how long has this been going on?
It's been going on at least 10 years in our practice. It started in New York sooner. So supervision for IVF has been going on probably since the 80s. And until it caught up with us, it took a little while.
And is there a specific entity that does this supervision?
Yes, in California, there's a group called the PUA, P-U-A-H Institute, that sends these lovely ladies out to, very unobtrusively, very politely stand in the lab and watch every step of the process to make sure that the kosher standard is being met.
Can all patients participate in kosher IVF?
Lineage in the Jewish religion is very important for various religious reasons, but that doesn't make it any less serious for non-observant Jews or other people. So I said, why not for everybody? In theory, they could. The good news is here at HRC, we have quite a good number of layers to protect people. We've always had 2 witnesses watching every step.
Does that supervision have to be by a Jewish person?
Yes, the person has to be Jewish, but observant and knowledgeable of the law.
What is the most important part of this service that we offer to patients?
The main thing is that I'm proud that the rabbis came up with a solution to allow Jewish people to do this in a way that was consistent with Jewish law that dates back 2,000 years.
What's your favorite part about this service for patients?
I'm just happy that we can help as many people as possible in a way that doesn't really become cumbersome financially or difficult for the lab. The systems are in place to make everybody feel comfortable, and that little extra bit of supervision that helps the observant population participate is also in place.
Thanks very much, Dr. Feinman. It's a pleasure. That's Dr. Michael Feinman, Westlake Village, California, and Encino. Thank you very much.